Fibrodysplasia ossificans progressiva, or FOP, is one of the rarest and most disabling genetic disorders known to science. In this condition, the body's soft tissues, muscles, tendons, and ligaments slowly turn into bone over time. It is as if the body's natural healing process becomes tragically confused, transforming flesh into rigid bone instead of repairing it. The disease is caused by a mutation in the ACVR1 gene, which controls bone growth and repair. Even a minor injury or injection can trigger an episode where the body begins to ossify tissue. Over years, new bone forms in places it shouldn't, across joints, in the spine, even in the chest, creating a second skeleton that locks the body in place. Most people with FOP lose the ability to move freely by early adulthood, trapped in a body that is slowly turning to stone. There is currently no cure, and surgery only worsens the condition because the trauma causes even more bone growth. Despite its horror, FOP has taught doctors a great deal about bone formation and the limits of the human body's ability to heal or misfire.
Harlequin ichthyosis.
Harlequin ichthyosis is a devastating and extremely rare genetic skin disorder that manifests from birth. Infants born with this condition have skin that forms in thick, plate-like scales divided by deep cracks, giving a distinctive diamond-shaped pattern. These hard layers severely restrict movement, breathing, and even facial expressions. The disease is caused by mutations in the ABCA12 gene, which is responsible for transporting fats to the skin's outer layer. Without it, the protective barrier fails, leading to severe dehydration and vulnerability to infections. In the past, newborns with Harlequin ichthyosis rarely survived beyond a few days. But with modern medicine, including intensive skincare and antibiotics, many now live into adolescence and adulthood. Progeria. Progeria, formerly known as Hutchinson-Gilford syndrome, is a rare genetic condition that causes children to age at an accelerated rate. Babies appear healthy at birth, but within the first 2 years, signs of premature aging begin to appear: slowed growth, hair loss, wrinkled skin, and a frail frame. The condition stems from a mutation in the LMNA gene, which produces a protein called lamin A, essential for maintaining the structure of the cell nucleus. The mutation causes instability at the cellular level, leading to rapid aging throughout the body. Children with progeria typically have the appearance of elderly individuals by age 10, and most die from heart disease or stroke before reaching adulthood. Despite the grim outlook, children with progeria are known for their intelligence, energy, and optimism. Their cognitive abilities remain completely normal, and their personalities often shine brightly even as their bodies fail them. Alien hand syndrome. Alien hand syndrome is one of the strangest and most unsettling neurological disorders ever documented. In this condition, one hand seems to act independently of the person's will, moving, grasping, or even resisting the person's other hand, as though controlled by an external force. This rare phenomenon occurs after brain injury, surgery, or stroke, particularly when the corpus callosum, the bridge connecting the two hemispheres of the brain, is damaged. With communication between hemispheres disrupted, one side of the brain can send motor commands that the conscious mind does not recognize or control. Patients describe feeling as if their hand has its own personality or intentions, performing actions they never chose. Some report their hand undoing tasks they just completed, slapping them, or grabbing objects against their will. Although terrifying, the condition offers profound insight into how consciousness and motor control are divided within the brain. Alien hand syndrome reminds us that our sense of control over our bodies is more fragile and more complex than we realize. Fatal familial insomnia. Fatal familial insomnia is a rare and haunting genetic disorder that destroys the ability to sleep permanently. It is caused by a mutation in the PRNP gene, which produces abnormal prion proteins that accumulate in the thalamus, the part of the brain responsible for regulating sleep. The condition usually begins in middle age, starting with mild insomnia and anxiety. As the disease progresses, the victim loses the ability to fall asleep entirely. Without rest, the body and mind deteriorate rapidly, leading to hallucinations, loss of coordination, memory failure, and eventually death, typically within 12 to 18 months of onset. Unlike other forms of insomnia, no amount of medication can induce sleep in FFI patients, because the brain's sleep center itself has been destroyed. The disorder is hereditary and extremely rare, known to affect only a few dozen families worldwide. FFI stands as one of medicine's most chilling reminders of how vital sleep is not merely as rest, but as a biological necessity that keeps life itself possible.